This segment is sponsored by Stone Springs Hospital Center. June is Men's Health Month, and today we learn why men's bladder health deserves more attention than you may think. Recently, we chatted with Dr. Nathan Roberts of Stone Springs Hospital Center about what men need to look out for.
I have been here at Stone Springs Hospital for the last 10 years. The hospital's been here for 10 years, so I actually came on board right when it was opening. So this has kind of been my home since I've been here. So it's been a great decade. There's a junk term that we use, something called LUTS, or lower urinary tract symptoms. And this is kind of a combination of all the different symptoms that you can experience, whether that be frequency, urgency, sometimes having issues where you go to the bathroom more at night. You can have hesitancy or obstruction where you feel like you're not getting everything out. The reason why this starts to happen around the age of 40 is because your prostate is starting to get bigger. So what is the prostate? It's an organ that sits right below the bladder, and it's involved in reproduction, but basically it's being fed by testosterone. So as you get older, that gland gets bigger and bigger. So as it gets bigger, the bladder has to work harder to get the urine to come through. So just like if I go to the gym and put a weight in my arm and do a bunch of arm curls, my arm gets bigger. Same thing can happen to the bladder. The bladder, as it pushes harder to get the urine to come out, the bladder wall starts to thicken. And that actually may change the composition and may make it so that it kind of loses some of its elasticity. And so therefore, as you get older, it's not uncommon that you start experiencing more urinary symptoms. So the most common things that you can see, it's very common for us when you go in to see your primary care or to see your urologist, that you would get a urine check. So a urinalysis is basically when you go into the office, they'll collect a little bit of the urine, and there is tests that we can run, and honestly can look at multiple factors or multiple things. It can look at the pH of your urine, it can look at if there's any blood, if there's any sugar, if there's any bilirubin, and it kind of, our urine can be a window into other things that are happening inside the bladder or inside the body. But also, as far as the prostate is concerned, prostate cancer screening is something that typically should start around the age of 45 to 50. If you do have risk factors, then starting at 40 is not a bad idea, and that usually involves a blood test called a PSA, which is something called prostate-specific antigen. So drinking a lot of water is actually very healthy for the bladder itself. Typically, you should be drinking at least 60 to 80 ounces of water a day. Especially as it gets warmer out, you need to put a little bit more in the tank in order for that to help. But honestly, good healthy living. So some of the things that you can do are just make sure you have a good exercise regimen. That's actually been shown to help with bladder health. And if you are a little bit overweight, actually there's literature that shows that if you do lose weight, that can actually help with the symptoms too. If you're a smoker, smoking cessation is actually very key too, because smoking is linked to the bladder cancer. Caffeine, but alcohol can also do it. Acidic things like fruit juices or fruits in general, that they also can cause those problems. If you enjoy spicy food, spicy meals can also cause those symptoms as well. So kind of making your diet a little bit more bland, and if we'll go back to the water, if you drink more water and try to stay away from the other stuff, that oftentimes can really help you with those symptoms you're experiencing. If these symptoms that you're experiencing are getting bad enough that you just have had enough, that's definitely something that's important. But if you ever see any blood in your urine, that's also something that's very important for us to investigate and try to figure out why that's occurred. If you've ever had any sort of stones, whether that be a bladder stone or a kidney stone, that's also something that it would be important for you to come to see us. Also infections. Men can get urinary tract infections as well. So if you've ever had an infection of the bladder, the prostate, or the kidney, that's all some stuff that you should see a urologist for. But there's plenty of medications, there's plenty of procedures that we can do to try to make your life better. Being a man myself, a lot of times we'll put our hand in the sand when it comes to a lot of these things, and this is honestly typically a gradual process of the things that we experience. And so it's usually men will say, hey, I can deal with this. But if you're all of a sudden realizing that you can't take trips, you're getting up and you're not getting a good night's sleep because you're getting up 3 or 4 times at night, this is something that we can resolve and we can make better. So it's a good idea just to come in so that we can talk about it. Actually, even today, I'm working in the operating room, and I am doing some cases for men who have had their prostates get a little too enlarged. So I'm going to go ahead and try to help them with that. This hospital has been great. They're very supportive with all these different types of procedures, and so they do a good job of trying to help men out here.
For all this information and more, head to stonespringshospital.com.